Some people brush their teeth the best they can in order to avoid dental problems and dental treatment. And that's a good thing, but sometimes too much. This video is about 3 common mistakes regarding brushing the teeth too well. The most common mistake is brushing too aggressively. People want to brush well and thoroughly, and they use a lot of force doing that. And then they end up damaging dental tissues. The first tissue to be damaged is the gum tissue, which leads to sensitivity to cold. The second tissue to be damaged is the tooth structure itself. Now, it takes long years of aggressive brushing, but it can end up in a real toothache. The right amount of pressure is when the tip of the bristles of the brush touch the teeth. Don't thrust the bristles against the teeth, because that is too much of a pressure. The type of brush or toothpaste you use is less important. What really matters is what you do with your hand, how much pressure you apply with your hand. It's not easy to change the way you brush because your hand is used to a certain kind of brushing. So it's important to constantly focus on soft brushing. And if your mind gets distracted, for example, because you use your phone, then your hand will go back to its old habits. You can force your hand to brush gently by holding the brush only with the tip of the fingers rather than with a full grip. Sometimes with brushing, we might notice something strange or even alarming, like sensitivity or bleeding gum. And then our mind comes up with all kinds of worst case scenario. I have infection, I have inflammation, I have a cavity. It's important to realize that our mouth is filled with many kinds of tissues, blood vessels, nerves, saliva glands, and more. And sometimes in those tissues things go wrong and we might feel sensitivity or bleeding. But luckily these tissues can renew themselves, they are regenerative. So if you feel something and you want to know whether it's a real dental issue, I suggest to wait a few days, and if it's a real dental problem, it should be persistent over time. Sometimes people invest a lot of money in buying expensive products for oral hygiene, thinking that that will change their oral health. But that's not true. Dental cleaning means mechanical removal of dental plaque. Chemical removal does not work on the long run. There are all kinds of commercials for toothpaste and mouth rinsing, but all these chemicals have really marginal effect. The only important chemical for the long run is fluoride, and that also has a limited effect. The real work is what you do with your hands. Gentle removal of dental plaque from each side of each tooth. I invite you to watch more of my videos on TreatYourDentalFear.com.